Okay, now my camera is on.
Yeah,
Yeah, and now
I
my
can.
speaker.
Yeah,
Now you
I'm
can
seeing.
see me?
Yeah,
Yeah,
yeah.
okay.
Uh,
Great. So this is where I am today. I'm seeing. I think I'll have to adjust it a little bit more. Okay. That's fine.
yeah, you're live, huh?
Yeah.
So, yeah, hey everyone. And so, like I said, this is going to be a very exciting live. And you're joined here by Dr. Zinal. She is a pediatrician as well as a lactation consultant. That's an IBCLC. And she's one of the finest that I know of. I can literally swear by what she has to say. I can, like, literally, she's just a call away for anyone. And so, Dr. Zinal, you're right here. And we can just start off, like it's so great to see you, Zina.
Hi, Dr. Ankita. Thank you so much for this. And I'm very happy to be a part with you along with the in India and Airway Collab to help create this awareness for people. Because even I have realized that, there is a long journey and a lot of learning to be done. In spite of the fact that, I was practicing as a pediatrician, once I started reading more and more, seeing more and more patients and interacting with you more and more, I realized that, yes, there is much more to learn.
Yeah, honestly, I really feel like medicine is a field where, there is so much changing every day and there's so much research every day that if we are not updated, we are still stuck to, some of the older trends, and sometimes
Absolutely, I
we.
agree so much with you this that every doctor or I think every individual for that matter, learning is a gradual process which should
Totally,
continue till the time you are alive. I
totally.
feel, learning can never stop. There's so much to learn and so much to actually implement it into our practices or into our daily lives. And
I
it
agree.
really makes a difference. Yeah.
I agree so much. So, Zinal, I know you have very less time today, and before wasting any time, I think we're going to have an amazing discussion on pediatric airway and sleep. And I'm very glad that we are here building up this community for doctors, parents, and everyone, where we are trying to increase this awareness. So let's just basically just start off with one of your most basic questions, that how important do you think that sleep or breathing is important for children, and how is it really going to affect their growth and development? Do you think it really needs to be addressed to parents, and how do we really go about this process?
So I think that, sleeping is one of the most essential part of a human body because we need to give it rest, right? And especially when you come to children are so active, they're roaming around the entire day. And then, then by the time they're sleeping, parents are like, oh my God, thank God he slept. So, most of the parents actually get a sigh of relief when their children are sleeping. Now, when they actually sleep, okay, observing your children, how they are sleeping, not many parents do, okay, Dr. Ankita. What some of them do is they are "हाँ, ठीक है, सो गया." So sometimes observing that is the child actually getting good sleep is also important. When we sleep, we actually transition into deep sleep, and we have 5 cycles of different sleep when we sleep. So is the child actually transitioning into deep sleep? Nobody knows. There are some children who are who keep tossing and turning, who sleep in very abnormal positions, or sometimes when they keep the mouth little open. Some children snore or they have a noisy breathing. So these things, I think many parents are aware and not many doctors are also aware and they don't ask this question. So now if the child does not go into this deep sleep phase, what happens is that the growth of the child, the development of the child, the brain does not get rest. It also leads to a lot of other problems like obesity. There are hormonal changes in that child. That child might have the immunity goes down. And because the immunity goes down, and the child is a kind of a obligate mouth breather, there's a lot of dust which goes inside the mouth. When we that breathing is very important, and that leads to more infections. So I think understanding that how good is the quality of the sleep, and is the child's lips completely close to each other, or the child is sleeping like that. Okay, that
Right.
is the first step which a parent should be able to identify.
Right, right. I also often see, when these kids are not sleeping well or they're not breathing well, their growth and development is very delayed. They're very tiny and they're very skinny according to their age group. So I think when y'all are actually checking the milestones and all, this is something which can even help you all relate that really is it the breathing or sleep which is really hampering here or no. Sometimes we can.
I agree with you. Last 2 3 years, I have started doing that. So when I get children when parents complain कि doctor ये बराबर सोता नहीं है, or they tell me that he doesn't eat well. Maybe even if when they tell me that they are fussy eaters, or if they tell me that doctor इसका वजन ही नहीं करता है, I definitely go into the sleep history, and I get to know that the most of the times that I have got an answer हाँ ये मुंह खुला रख के सोता है.
Yeah.
So that is what I have. So I think probably we as pediatricians also don't ask that question because we are busy and we have no time. So
Right.
I don't blame anybody, but we have so many patients sometimes waiting. But when you actually go into the detailed history, so when I was learning medicine, the most important thing my professor taught me is that history taking should give you the diagnosis, and I have still stuck to that. That
Yeah.
my history taking should tell me what am I going to see after examination or after investigations.
I agree. I agree. So, Zinal, coming to this, we are in these crazy times of this pandemic like COVID and everything related to the breathing, right? So, why do you think that nasal breathing and COVID would be so important? Like what really is going to matter if they are mouth breathing and if there are viruses and infections like this?
So I think breathing is an essential part of our living. Even when we are sleeping, we are breathing, right? We are breathing 24/7. And most of the times we are not even conscious of our breath. I don't know how many of us are actually understanding how much we are breathing. Some people actually do mouth breathing and they don't realize, like even adults for that matter, forget pediatrics. Like, you get breathless or out of breath and you're doing mouth breathing and you are not actually doing proper nose nostril breathing, because see, God has made breathing through the nostril like an inhalation and an exhalation for a reason. Because when you inhale through the nostril, the air actually gets purified, it gets humidified, okay, and that air is actually going to get warmed and filtered also. And that air, when it enters into the lungs, okay, the quality of oxygen is much different. So
Right.
the nasal breathing is very important, which I think COVID has taught us. I think there have been a lot of videos circulating and a lot of people about pranayam and annavilom, and people have been actually even following the deep breathing techniques, which actually works. The reason it works is, or it should be followed by everybody, because I think when we normally breathe also, we do not utilize 100% of our lung capacity also.
Right.
Our lungs are not completely utilized, so we need to open up our lungs, and for that it is very important to do nasal breathing. So I think that helps in COVID situation also, because the COVID hits the lungs. So if
Right.
your lung capacity is good, okay, then the percentage of damage, if at all COVID hits your lungs, is very very minimum. So I
Right.
think during COVID it is absolutely important. There are people have actually done those things also, putting water through one nostril and putting water through jal nidhi, it is called jal nidhi. So
It
people
does
do
help.
jal nidhi, people do annavilom. So I think these things are very important, because
Right.
if you're going to be mouth breathing, there are higher chances of virus entering in through your mouth and then going and sitting in your throat and your lungs. So actually, no breathing will protect you against COVID also.
I agree. Interestingly, I came across certain researches. Now, what they said that when we are actually nasal breathing, it produces a chemical called nitric oxide. And this nitric
Yeah.
oxide is fighting against the bacteria and viruses, which doesn't happen when we are actually mouth breathing. So, those who are actually nasal breathing, a lot of them are fighting against COVID. Interesting study, but
And you know
quite
what? And you know
expensive.
what? Since we're talking about nitric oxide, no, today only morning in one of my pediatric groups, there was a discussion. I'm going to definitely share this video on that group
Yeah.
also.
Yeah.
There are a lot of companies which have come up with nitric oxide sprays. Okay,
Oh,
and there is some UK study which is showing that if you use that nitric oxide spray, or you have less, the COVID virus gets killed in the nasal area or in the mouth area only. And they are
huh?
promoting it like, a lot. So this apparently they're saying that is going to be a breakthrough treatment if at all this is proved. So they have done the study on I think 79 patients, and they are still continuing to do it. That if you have been exposed to COVID and you use a nitric oxide spray, okay, but
Huh.
I feel that when God has given you natural nitric oxide, why do you need a spray?
I agree. And then it's such a
Breathing.
basic, in yoga we do humming like that produces so much nitric oxide.
Yeah, true, true, true. I agree. And believe me, let me tell you, Ankita, I think because of doing this, I do a lot of this om and humming sound and, Brahmi and Annavilom and all. I think that has only protected me till now, because I have been working from day one of COVID. I've not stopped working.
I know,
So
I
I
know.
feel that is only touchwood protected me, that, probably have not, because of doing these breathing practices.
I agree. Interestingly, even how often do you come across these thumb sucking and lip sucking, finger sucking? I come across these kids so often, And most often I have found that whichever are these kids with these habits, they have these tonsils, adenoids, they're either snoring, they have mouth breathing, ear infections. Sometimes there's also a tongue tie in these patients. Most often we see that there is some form of breathing discrepancy with these kids when they're actually thumb sucking.
So actually, why do these children suck the thumb? That is the first question. Why does thumb sucking come in? Like most of the times we relate it to insecurity or social security, or maybe, they don't want to be separated from their parents. But I think if you go back and see, go proper history taking, children who have thumb sucking, or probably who have a habit of a pacifier, or also who do lip sucking, or, nail biting, those children are mouth breathers.
Yeah.
And they are, because they are mouth breathers, and that is why the tongue actually doesn't go and rest on the palate. Okay, so because the posterior tongue and the anterior tongue is not resting on the palate, there is a lot of space. So to
Right.
cover up for this space, they actually land up putting their fingers, and this most of the times even doctors don't realize. And when these people keep coming, babies keep coming back to
Right.
us, we
Right.
actually land up giving, we will give steroids, or we'll give antibiotics,
Right.
and we will sometimes give ayurvedic supply. I mean, I have used, I'm not denying, we have used all that penicillin and you stop colors, you do that. We try everything, but then these children keep coming back for adenoid infections. And how much antibiotics are we going to use? So when there are enlarged tonsils and when there are enlarged adenoids, I think going back and assessing the mouth, assessing the jaw, and doing a complete assessment is very important. Ankita, you were mentioning something to me about myofunctional therapy, which you have been doing,
Right.
and a lot of breathe retraining. So can you put light over here so that, all the doctor colleagues who are watching this will also understand what it is?
Right. So we actually, give some flexible mouth guards, and these mouth guards, they help in removing any extra muscle forces. So that is going to help them position the tongue correctly, and the jaw growth changes with it. And at the same time, we are also giving a lot of breathing exercises. And myofunctional therapy is all about exercise of muscles of your face, tongue, head, and neck. It's also called tongue therapy. So a lot of exercise of the tongue. So the minute we start correcting this, we correct the breathing, the swallowing, and we correct your jaw growth. These kids stop thumb sucking, unless, every time we are giving them a punishment like Femite and all. Honestly, I don't believe into so much punishments, because sometimes they're involuntary doing it in their sleep. It's not like on purpose that they want only.
Yeah,
So
true,
actually,
true,
there's a
true.
different cause, and when we actually look at those different causes, we are being able to help these kids all the more.
So,
Oh,
the problem, Ankita, is acceptance and referral. Like for that matter, I think something like tongue therapy or myofunctional therapy, not many people are aware of. I think
yeah,
even in my circle of doctors and whosoever I've been talking to, whether it is ENTs, pediatricians. So I think this is very important to understand, that try before giving the antibiotics to correct
right,
the actual cause.
right,
To identify the cause and to correct the cause. So probably, if exercise can help, okay, why not accept that and try it out at least? We are
right.
not losing anything over here other than there's some time and little money which is going to go.
Right. Like, I do not disagree that sometimes antibiotics are required when they're extremely inflamed or infectious or something like that. Agreed. But if it is repeated episodes, then these things will definitely help get down the sizes and everything.
Yeah, because the number of times that child is coming back to you, if it increases a lot, we say more than three, that means you have to think about that something else is going on inside.
Right, right. So, Dr. Zeeman, there's very interestingly, now if that's your nose and that's your upper jaw, look at how the floor of your nose is related to your upper jaw. If your upper jaw is narrow, look at what happens to the nasal cavity. It starts going down.
Yeah.
Yeah. So there's a septum in between, and then we see crooked noses and deviated septums. And sometimes, your jaws are also, if we understand that the jaw is right in front of your breathing pipe. So anything in and around this area, your nose, jaws, your muscles over here, everything is going to affect your breathing and sleep in the end. So interestingly, I also feel that a lot of times when we've had deviated septums and we try and widen the jaw, correct the jaw growth very early on, the deviated septums disappear. There's no more
Wow,
any
that's
deviation of
nice.
septum. Yeah.
That's really
Quite
nice.
interesting. So,
Okay.
so Zina, what else would you like to talk on? There's a question by Neetu over here, and she asked that should the lips be always closed while sleeping in children, or can we see children sleeping with the mouth for some time?
So ideally, what I say is that majoritarily, yes, the lips should be closed. But sometimes when children are very tired or probably, they are little stressed, then they do have a tendency to keep the lips open. So on an average, if your child is keeping the lips open more than 3 times a week, then you should definitely be getting worried, or, you should definitely get the assessment done.
Yeah, roughly I would say 90% of the times it should be shut, 10% here and there understood.
Yeah.
Yeah. Zinal, I come across a lot of grinding of teeth in children, and what do you think? Like, what's your take on a pediatric?
Okay, so this is a very common thing. I think this common thing which I come across is grinding of teeth. So
Right,
what we as pediatricians always do is we first try and identify that why is this child having grinding of teeth. The most common diagnosis is the child could be having worms. So we kind of give deworming medications.
right,
Sometimes the child could be having magnesium deficiency, or maybe we give some calcium or some multivitamin and see that if the child is a poor eater, then probably the child might need some more supplements. But then
right,
after doing all this, also if the grinding of teeth doesn't go, or if
right,
the child really does grinding, okay, that means you need to assess the oral anatomy, and you need to understand that why this is happening. Okay, now, the grinding of teeth will also happen because maybe the sleep of the child is not going into the deep sleep, or maybe the child is very restless,
right,
right? It could be a manifestation of not sleeping properly
right,
also.
right,
So that also is very important. So when also because I think as the jaw is not very stable. So because the jaw is not very stable, as you said about the upper jaw, so even the lower jaw might not be stable, and that is why it keeps moving up and down on the left side and side. So
right,
I think assessment is required if after
right,
correcting other causes of grinding of teeth, if it is not going,
right.
so we need to assess that children.
Right. So, when I look at it as a dental side, what we see is that when they're sleeping and when we actually fall into these deep stages of sleep, all muscles relax at that time. You're more like a paralyzed body. So, all muscles are also relaxing. But if any of these muscles are obstructing your airway, or any obstruction to the airway is there, that's your breathing area, may it be by the nose, mouth, anywhere, there is any kind of obstruction, your body is beautifully made. We are made to compensate all
Yeah.
the time. So we will try and open up the airway. So we tend to bring our jaw forward like this. And because it's such an unstable position for your jaw, because there's no correct bite for it at this place, you tend to clench. And then
Clench.
these clenching episodes happen throughout the night. And over a period of time, not only in kids but even in adults, you end up having a lot of sore jaw muscles and eventually have a lot of joint
Yes.
issues also then.
Yes.
Yeah.
True, true, true. Very true. So yes, we do see commonly a lot of this, okay? And most of the times, no, these children who are actually clenching their teeth are mouth breathers, or they're probably snoring also.
Right, right. So, how often do you think, like, how many kids do you come across with snoring or something like that? Do you see them often?
So as I said, 'cause since the time I have started taking history, so I would say at least 3 out of 10, I see that probably yes, children are having either they are keeping the mouth open or they are snoring, one or noisy breathing, one of the
Yeah,
three.
yeah, I agree.
And
And
to be very honest, since because I'm a lactation consultant now, when they come to me with, see, I have only problematic babies who come, mothers who can't breastfeed who come to me, right? So when
right,
they're coming to me for breastfeeding, that is the time when I'm noticing that even those newborn babies who probably have a tongue tie or a lip tie are
right,
also keeping their mouth open and sleeping, which parents don't realize.
yeah,
I'm seeing a lot of them, and I just see, when the jaw is very tiny, the lips, the lower lip goes inside and the upper lip comes out, and there's so much of gap in between. So
right,
when I ask the parents, have you noticed this? So they say no, because they don't know that this is to be noticed.
right,
But
right.
when I tell them that, okay, notice this, then they understand, okay, oh, this is not something which is normal.
I agree. So, ideally, the entire tongue needs to be resting up like this
On the
and
palate.
on the
Yes.
palate. So, if there's like a tongue tie, in previous times or in colleges or schools, the diagnosis of tongue tie was very different. If it's just seen at your tip, it is called as a tongue tie. But with the whole school of airway and sleep, their diagnosis of tongue tie is very different. They see a functional diagnosis. So if the entire tongue is not resting up, they consider that as a tongue tie, and they consider this as a fascial restriction. So what generally
Okay.
happens is that only your tip of the tongue is resting up, but if the remaining part of the tongue is not resting up, it's going to fall back into the airway. So a lot of
True,
times
true.
it is just because the muscle doesn't have enough exercises and tone. So that's when we give these myofunctional and tongue therapy exercises
Yeah,
to help
true.
position the tongue correctly. Or otherwise, it may obstruct the airway, and sometimes they also come across mouth breathing and snoring because of these things. We
Right.
have one more question here asking if we could suggest some breathing exercises for a 4-year-old. Now, I would say, go with some very basic exercises. There's one very interesting thing that you can do is something called as breath holds over here. So you do a deep breathe in, do a deep breathe out, or your lips have to be closed at all the times. You pinch your nose, hold the breath till how you're comfortable. The child shouldn't be hyperventilating. And eventually, when you feel that you're uncomfortable, you release your nose and continue shallow nasal breathing and repeat it at least 6 times continuously, And initially, you may see that the breath holding is very less. So if your breath holding is like 10 seconds or 12 seconds, it's actually really poor. A good breath hold is at least 30 to 40 seconds. So this is something which would help you. And with kids, I would also say if you want to make some fun activities, ask them to blow balloons. That will help with breathing. Ask them to do a little humming with, nasal singing of songs with a nasal twang. That will also help in increasing the nitric oxide. Something really fun that I make them do is with straws. If you ask them to suck up a piece of paper or grains at home, I remember as kids we used to do this as games, that pick it up from one and put it into the other plate. So
Yeah.
this also helps in a lot of breath retraining. Okay. So I hope that will answer her question. Zinal, what's your take on ADHD or hyperactivity in kids nowadays? They have so much attention deficits and
Oh.
concentration problems.
To be very honest with you, I can imagine how frustrating it is for parents currently to handle their children to keep them indoors. And last 1 year has been crazy. I think we have seen a lot of rise in behavioral issues in children, and a lot of other issues that they don't understand, especially smaller children. They don't understand that why they are not getting out of the house, why they are not going down, why they are not meeting other people. So I think it is a sad situation for those babies. But yes, to be very honest with you, I am seeing a lot of children with behavioral problem, and these problems, I don't know whether to call them ADHD or whether it is pseudo ADHD or whether it is actually only hyperactivity, but we are definitely seeing a lot of children. But when they come to me with this, okay, when they come to me with this, "Okay, doctor, my child has become very hyperactive or aggressive, or he's become a fussy eater," then I go into the detailed history of understanding that are these children are they mouth breathers or are they having snoring? And I'm telling you, 70% of those children are actually having breathing disorders, and they are also having sleep disturbances. So they are
Yeah,
not sleeping well. So
yeah,
actually, if your child, see, temporarily, if your child is having, as I said, there could be pseudo ADHD. So what I
yeah.
mean by that is just because of the situation and circumstances, and I don't like labeling any child as ADHD. That in first place, I don't do any labeling. I don't do any, pointing out. I just tell that, there is something which we need to work on to make this child better. The
Right.
environment of the house, the behavior of the child, plus the social quotient, okay, which children are not getting currently. I think the social quotient is so low that I have parents who have actually come and told me that immediately after the first lockdown, when they started going out, the child used to cry seeing other people because they have never seen other people in their lives.
I know, I know.
Okay, so that's a completely different topic. I think we can't take that now. The point I'm trying to make is when you are seeing any behavioral changes in your child and you think that your child is getting hyperactive or your child is not sleeping well, better get it assessed. That is the most important message I would like to give you.
I agree. So what generally happens is there's less oxygen. So imagine now, even we as adults also, if we've not slept well, we are so cranky and irritable the next
Yeah.
day. Why wouldn't a child do it, right? If every 2 3 nights they're not getting a good sleep, they are going to be frustrated. So they are going to be hyperactive. They don't know how to react. That's the only way for them to react with, right?
True,
So
true, true.
Dr. Zeenal, even like I get so many parents that, my child is so fussy in eating and they have such picky eating issues, or they're filling food in the mouth for longer times, they're spitting out food or gagging. and then they are like, if it's their favorite food, they might start eating. But honestly, they are like fussing all the time, and they have a hard time tackling kids. And I totally agree with parents. Like, it's really tough feeding a child over, like for an hour. It's not easy.
I don't know, somehow, no, to be very honest with you, I think parents are getting so over obsessed with food that they run behind the child with a plate and, they will kind of show TV and they will kind of distract the child and see stories. And there are multiple ways which they will figure out and still that child doesn't eat. Now, let
Yeah.
me tell you, when this is coming, okay, when this child is fussy, we need to think of other things. We need to think beyond some things. They'll come and tell me, Madam, kuch tonic de do. Madam, kuch protein supplement de do. I have these questions. Can I add something in milk and give to my child? Looking out for shortcuts. So the first message is don't look for shortcuts. Okay, there are no shortcuts in life, and whichever other shortcuts are not the good cuts. They are not going to do any good to you or your children. So please don't opt for shortcuts. That's the first thing. Now, whenever we eat food, okay, tongue plays a very, very important role. Okay, our tongue plays an important role even in our speech. It plays an important role even when we are gagging or when we are trying to chew. So the food morsel has to completely form a bolus with
Right.
the help of the tongue, and that goes from we need to chew it properly, and then only we can actually put it down below our esophagus. So in children, when the tongue is not moving to the optimum capacity, or maybe probably there is some restriction to the movement of the tongue, or there is some fascia which is kind of obstructing the tongue movement, what is going to happen to this food is that it will keep moving inside the mouth only, right to left to right. And that time some these children, they will put up the mouth at the corner and they will keep holding. And also parents tell me कि ये पूरा दिन एक घंटे तक एक निवाला मुंह में रख के बैठता है. So actually that niwala रख के बैठना is nothing because he doesn't know how to do it. His tongue is not moving, and that is why these kids, if you actually go back and see, they will typically have a very narrow jaw, or they might have completely backward jaw, or they might have a tongue restriction or a lip restriction. So there might be things which we need to assess in these kind of children.
I agree. I agree. And I also, always tell parents that, identify if you had to put your tongue between your teeth like this and swallow now. How much force do you have to give to, have one bite of food? Now, if every bite of food the child has to do that again and again, that child from birth has never learned how to swallow correctly, doesn't know what swallowing is like. So then he's obviously going to be a very slow eater or going to keep the food for a longer time to make it easier for them,
Yeah.
right? So it's interesting. And typically so much of myofunctional therapy is being used in the West. In fact, of late I saw certain articles where Kourtney Kardashian and DJ Khalid and some basketball players, and these all people have started doing it. It's becoming like a trend in the West. And they have been understanding the importance of breathing and sleep. Unfortunately, I just feel that we all need to get aware of how it's such a basic thing. If we lose our breath, we have nothing left in our body. So in the end, that's one thing that's so important to us, that simple things, like, and these therapies are so easy. They can be made fun for kids. They're done online. Like, I can just practically tell, like, parents should really try out these things, today. uh, so, Dr. Zira, what do you think? Like, what's like a little piece of advice that you would like to give these parents, or you even to the
Um,
doctors today regarding this?
so I think the most important advice I would like to give my doctor friends is that try to go deeper into the history taking to identify whether there is any restriction so that you can correct it, because the jaw correction can happen only before the 12 years of age. So when you have go into the sleep history of that child and try and assess the mouth, that will really help you to correct a lot of things when you pick up at an early stage. So
Mm.
early intervention reduces a lot of things later, because these children are later going to have crowding of teeth and then braces. And I have seen children who have speech problems also, and at later teens. In fact, my daughter also had it. Remember, Ankita, I got her to use. So
Yeah.
she used to, her confidence went down because she used to not be able to pronounce "r," and because of her tongue issues, some alphabets were still not clear. So actually, you're going to work on a lot of other problems. You will prevent it if you identify it early. So
Right.
early identification,
Right.
okay, and we should be open to accepting and learning everything. That's what I feel we today are at, because COVID has, now we are seeing so many pediatric COVID patients also we have never seen in our lives. How much ever you say, even the senior pediatrician, nobody has seen COVID. We are learning.
Right.
So learning is the most integral part of life today. That's what the most important message I would want to give. And to the mummies over here, I would really like to first applause, give you all an applause for managing so well. Because I think all the women over here are completely super moms who are managing their home, managing their personal work, managing their husbands, their in-laws, their children, their gym. I know how difficult it is. And I think we had quite a lot of time where we had no maids coming in, where we have no support system, where we have no help, and we are still managing.
Yeah.
Okay. Firstly, hats off to all of y'all for being here, for listening to this, and also, putting a nice smile and being a happy mother. So I think the most important message I would want to give to all of you is that stay happy. If you are happy, you can give happiness to everybody else. Okay.
Right.
Don't panic over small things. Okay. Don't kind of be a helicopter parent. Use your common sense and try and behave more maturely, and you'll be able to handle any situation which comes your way. Thank you.
Right. Right. And to all my dentist colleagues, I think, or parents, I would like to give you all one simple thing or a message that we need to really start looking out for these problems. And it's much more common that we ever thought of it was, and typically we all know that at age 12 jaw growth is completed, and then with braces we simply move the teeth up and down, right and left. We are not correcting jaw growth, and on a longer term these teenage children and adolescents, they're all having joint pain and they're all having these sleep problems at that age, and it's pretty much in surgical at that age. So if we correct early on, it's so much better for these kids. Their growth and development is so good, their brain development will be so good. So it's best to approach early. And for moms, you don't have to worry or get stressed with all these things. They are simple things. Sometimes it's just a stagnancy also, like with kids, a lot of times in front of the screen they just tend to open their mouth and sit with their mouth open like this, because they have nothing else to do. They are concentrating on the screen with the mouth open. So sometimes it just becomes like a habitual mouth breathing. So it's very easily correctable, nothing to worry. But let's start paying attention to our breathing and sleeping patterns over here. I know, Dr. Zinal, you have a long day ahead more, and we have lots more to chat on this topic. But let's do a live soon again, and I hope
Yeah.
you're going to help to so many kids change their lives and have a brilliant future ahead. Well,
Thank
I
you.
would like to thank all the audience, and Dr. Zinal is available at Criticare, and her Insta handle is Dr_Zinal. And if you want to find me, my Instagram handle is Dentition India. So I hope to see you guys soon. And if you have any more questions, you can still say comment on the live below. We will answer those questions even later. Thank you so much. Bye,
Thank
Zinal. Thank you.
you. Take care. Bye. Bye. See you. Bye.